Welcome to my channel. 1. A 30-year-old male from Haiti is brought to the emergency department in sickle cell crisis. What is the best position for this client? A. Side lying with knees flexed. B. Knee chest. C. High fowlers with knees flexed. D. Semi-fowlers with legs extended on the bed. The answer is D. Semi-fowlers with legs extended on the bed. 2.25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? A. Taking hourly blood pressures with mechanical cuff. B. Encouraging fluid intake of at least 200 milliliters per hour. C. Position in high fowlers with knee gauge raised. D. Administering Tylenol as ordered. The answer is B. Encouraging fluid intake of at least 200 milliliters per hour. 3. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat? A. Steak. B. Cottage cheese. C. Popsicle. D. Lima beans. The answer is C. Popsicle. 4. A newly admitted client has sickle cell crisis. He is complaining of pain in his feet and hands. The nurse's assessment findings include a pulse oximetry of 92. Assuming that all the following interventions are ordered, which should be done first? A. Adjust the room temperature. B. Give a bolus of 4 fluids. C. Start O2. D. Administer meperidine, Demerol, 75 mg for push. The answer is C. Start O2. 5. The nurse is instructing a client with iron deficiency anemia. Which of the following meal plans would the nurse expect the client to select? A. Roast beef, gelatin salad, green beans, and peach pie. B. Chicken salad sandwich, coleslaw, French fries, ice cream. C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. D. Pork chop, creamed potatoes, corn, and coconut cake. The answer is C. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. 6. Clients with sickle cell anemia are taught to avoid activities that cause hypoxia and hypoxemia. Which of the following activities would the nurse recommend? A. A family vacation in the Rocky Mountains. B. Chaperoning the local boys' club on a snowskiing trip. C. Traveling by airplane for business trips. D. A bus trip to the Museum of Natural History. The answer is D. A bus trip to the Museum of Natural History. 7. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which finding reinforces the diagnosis of B12 deficiency? A. Enlarged spleen. B. Elevated blood pressure. C. Bradycardia. D. Beefy tongue. The answer is D. Beefy tongue. 8. The body part that would most likely display jaundice in the dark-skinned individual is the A. Conjunctiva of the eye. B. Soles of the feet. C. Roof of the mouth. D. Shins. The answer is C. Roof of the mouth. 9. The nurse is conducting a physical assessment on a client with anemia. Which of the following clinical manifestations would be most indicative of the anemia? A. BP 146/88. B. Respirations 28 shallow. C. Weight gain of 10 pounds in 6 months. D. Pink complexion. The answer is B. Respirations 28 shallow. 10. The nurse is teaching the client with polycythemia vera about prevention of complications of the disease. Which of the following statements by the client indicates a need for further teaching? A. I will drink 500 milliliters of fluid or less each day. B. I will wear support hose. C. I will check my blood pressure regularly. D. I will report ankle edema. The answer is A. I will drink 500 milliliters of fluid or less each day. 11. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following findings is most likely related to the diagnosis of leukemia? A. The client collects stamps as a hobby. B. The client recently lost his job as a postal worker. C. The client had radiation for treatment of Hodgkin's disease as a teenager. D. The client's brother had leukemia as a child. The answer is C. The client had radiation for treatment of Hodgkin's disease as a teenager. 12. Where is the best site for examining for the presence of petechiae in an African American client? A. The abdomen. B. The thorax. C. The earlobes. D. The soles of the feet. The answer is D. The soles of the feet. 13. The client is being evaluated for possible acute leukemia. Which inquiry by the nurse is most important? A. Have you noticed a change in sleeping habits recently? B. Have you had a respiratory infection in the last 6 months? C. Have you lost weight recently? D. Have you noticed changes in your alertness? The answer is B. Have you had a respiratory infection in the last 6 months? 14. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? A. Oral mucous membrane, altered related to chemo therapy. B. Risk for injury related to thrombocytopenia. C. Fatigue related to the disease process. D. Interrupted family processes related to life-threatening illness of a family member. The answer is B. Risk for injury related to thrombocytopenia. 15. A 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? A. Sexual dysfunction related to radiation therapy. B. Anticipatory grieving related to terminal illness. C. Tissue integrity related to prolonged bed rest. D. Fatigue related to chemotherapy. The answer is A. Sexual dysfunction related to radiation therapy. Thanks for watching. For more, subscribe the channel.